Mhm.
You were born
Yeah.
into a family of extraordinary courage and a deep commitment to social justice. Tell me about your formative years in the milieu where you grew up in Lynchburg, Virginia.
Mhm. So I was born and raised in a beautiful city, Lynchburg, Virginia, bucolic setting at the jagged edge of the Jim Crow era in the early 1960s. And I call that the jagged edge because this was a time in which our country and our community was emerging from a very difficult history. But I grew up at a time where there were divided schools and divided lunch counters. And injustice ran through the streets that I learned to play catch in like rainwater, running toward a drain. But my parents wanted a different trajectory for both me and my sister. They wanted us to have a life that they did not have. My mother, a seamstress in a sock factory, never finished the 10th grade. My father was a postal worker. But probably most importantly, in that nuclear house, my mother, father, and sister, was my grandmother that lived next door, who I call a purveyor of hope, someone who fed hope and aspirations.
You were clearly bathed in a cauldron of adversity. So, what did this teach you about strength, identity, resilience, and a sense of
Yeah.
purpose?
You talk a little bit about adversity, but I was brought up in that cauldron of adversity, not in my home, but outside of my home, going to the integrated schools where I was the only black kid, Negro kid in my class for the first few years. And there was a sense of isolation, and I felt that my ethnicity was to some degree a liability. And that I learned at that point that I did not subscribe to the traditional narrative of resilience. Bad things happened and I bounced back. No, I thought that the things that happened to me created cracks, but every evening my mother, my grandmother would fill those cracks with liquid gold. And they made me not resilient, but anti fragile. That is, I was stronger in the broken places, as Hemingway spoke. And I think I carried that mentality that not of resilience, but of recognizing that things will happen to all of us, irrespective of our backgrounds, and we must learn to be anti fragile, not resilient.
So, looking back at that time in your life, what was guiding you, and what was your vision or goal for the next step in your journey?
Yeah. So, Henri, I think one of the things that resonated with you as a person when we were just 17-year-olds, for me, away from home, you just kind of a few subway stops up in New York City, was this pursuit of excellence. And again, I apologize to our audience, but it was the desire to change the world. And we were young, arrogant, headstrong boys in New York City. You called me the country bumpkin, and I called you slick in my mind. But we wanted to do something beyond what our environment told us. My grandmother would say to me growing up, nothing superior in life is ever accomplished by those who didn't believe that they were superior to circumstance, not superior to people. And I felt that we kind of made that pact that even though we would part ways, you would go to a community college in New Jersey, Princeton, I think they call
You,
it,
you became a
and I would go to
locksmith.
that. Yeah. But, but we would be committed to do excellence beyond our own achievement, but in a manner that would impact others, society, and something greater if possible.
And I hope we're going to get into that. Now, you did attend Yale University, and
Mhm.
you excelled academically.
Yeah.
Even though, and you're in an environment where you were surrounded by dreamers. So
Yeah.
tell me, coming from Lynchburg and the background that you had, did you ever fear that you didn't belong? Did you ever have that sense of an imposter syndrome at Yale? And if so, how did you assuage this fear?
I didn't doubt my intellect when I got to Yale. I didn't doubt that I belonged to at Yale, but I did have doubts about whether other people thought I belonged at Yale. I was a Southerner, I was African American, and I was admitted through the gates of affirmative action. And I was often hyper aware of how people who didn't look like me saw me. So I became manically, if not maniacally, committed to excellence. I had to be undeniable in everything I did, paper, exam. Even as you probably know, I started fencing, something I was never exposed to. And this concept of how I would pursue excellence was important. And I think it's important to explain this for people who might experience this. So I internalized the belief that I could outrun the stereotype, um, and any suspicion about who I was.
So, Ed, you clearly excelled academically, but you also excelled athletically. You became an All American fencer, as you alluded to, a number four in the country. So, what happened? How did this experience actually influence you? And tell me a little bit about the role of coaching in helping learners
Yeah.
achieve excellence.
Well, I think that, the powerful metaphor of fencing is not my achievement. The powerful metaphor is that I learned the importance of three things: mentoring, sponsorship, and coaching. So, I'm just a boy from Lynchburg, Virginia. I didn't know anything about fencing. And so, what I learned through fencing is discipline. I learned that it's not always about talent, but in that environment, my coach had been a bronze medalist at the Olympics. He's 93 years old, he's still alive. And he felt that he could train American surgeons. And so, it was a 3.5 hour commitment every day. I stayed in the summers, hour lessons twice a week. And so, again, what I learned there is discipline, the role of mentorship and sponsorship, and the role of coaching. Even when, like me, I didn't have a ton of talent, but I finished fourth in the country at the nationals, and just missed making the Olympic team for Olympics we didn't go to in 1980. And so, again, that's what I learned. And I've translated that into surgery, into training, into building teams, and into coaching.
So after Yale, you attended Harvard Medical School, where we reunited, and then you went on to do your general surgery at the Massachusetts General Hospital, where you became the
Yeah.
first Black super chief resident in the history of the MGH. What an accomplishment! So, so
Along
tell
with
us,
Lent Johnson, we
along
shared
with
that
that's right.
that role. Mhm.
Yeah. So tell the audience a little bit about what you remember about the first time you scrubbed into surgery, and how did you manage to flourish in this environment, not just at the medical school, but also at MGH to become the chief resident, the super
Yeah.
chief.
Well, it started in medical school. Medical school, the MGH experience was a continuation of Harvard Medical School. And I learned when I was a medical student rotating at the MGH that I wasn't the smartest, that I wasn't the most talented, but I was very environmentally aware. I knew that I needed to listen more. I needed to anticipate the needs of those that I was around, and that every moment was an opportunity for growth. The 12 years I was in Boston were a magical experience. And what I also recognize, getting back to the coaching and mentorship, I was around other talented people who were my peers. I was among world famous surgeons who not only were technically gifted, but demanded excellence, but also were gracious in sharing their wisdom. Those things converged for me to develop an understanding of what surgical leadership would be. And again, that much like fencing, it's a developed skill. And so I learned about the importance of practice and repetition. And also, even more importantly, humility, because as you know, things happen.
Great. So after MGH, you went to Cincinnati to
Yeah.
pursue pediatric surgery. What drew you to
Mhm.
pediatric surgery?
What drew me to pediatric surgery were two things. One was you, actually, and so our friendship was tight. We were going into surgery, and you had that love for the experience you had at Boston Children's. My love for pediatric surgery emerged in my internship when I rotated at the Shriners, and I saw burn kids, and I saw how, I used the term at that time, resilient they were, but I realized that kids would have devastating injuries and they could bounce forward. And I wanted to be in a field that was a generalist field, that I could do lots of different things, but I wanted to take care of patients who were inspired or aspired to be better with time. And it was magical. That time at the Shriners Burn Institute, I met one boy who changed everything for me and made me know that I was addicted to doing pediatric surgery.
So in 1994,
Yeah.
for good or bad, I convinced you
Mhm.
to join me at the Children's Hospital of Pittsburgh, where you
Yeah.
took a program that was in its infancy and transformed it into the Intestinal Care Center,
Yeah.
the first
Mhm.
interdisciplinary program in the world to manage intestinal failure and use intestinal transplantation for patients with short gut syndrome. In fact, this work has now been truly transformation. Not only has it been
Mhm.
transformational, it has actually been adopted by others pretty much across the world. So, what was your vision when you took on that role, which I know wasn't a popular one? And how did
No.
you go about building something
Yeah.
so impactful and transformative from the ground
Mhm.
up with little support?
Well, it was the words of Dick Simmons. And what he said, not maybe directly to me, but he said that if you share credit, then you can do anything. And so, this concept of collaboration, being what my father would call a boundary spanning leader, is what allowed us to get this off the ground. We brought transplant surgery, pediatric GI together. And for me, again, this social work grandmother, the least, the lost, the left behind, I got tired of hearing that growing up, but I've embraced it. And I saw children with chronic disease, intestinal failure, and liver failure dying before the age of 5 of fitting that mantra. And I felt that if we could create a holistic model of care, that we could advance innovation, advance science, and improve care by bringing best standards. And that led to us utilizing step procedures and bowel lengthening and a variety of agents. And we became the vanguard. We went from 5 patients a year when we started the program in 1996 to 450 that we were following when I left.
Let's move on to 2007 when you became the surgeon in chief at Rainbow Babies and Children's Hospital. Um, you refer to this move as a pivot from academic success to social significance.
Yes.
First of all, what spurred this move, and what exactly do you mean by this phrase?
Well, let me start by what spurred it. So, quite honestly, when I got to Cleveland, my first patient was a 14-year-old boy who was shot in the groin, who looked just like my own 13-year-old son. He came in dead and he left dead. And I realized that here I am, the second chief of pediatric surgery of color, and have this great position, and I can't even save the whole lifetime of a child. And so I began to think creatively and collaboratively as to how we could change the narrative for urban Cleveland. So I went out into the streets. I did things with the police I would never do. I went into crack houses, shooting dens. I met with gangbangers. I wanted to understand, if you will, the terror that these vines of children were growing in an effort to develop a program. And I saw that many of the children were just like me 40 years before, but they had not been cultivated in the way that I had. Their soil was the same, but the cultivation was different. So we wanted to develop a program that recapitulated the concept that I brought to you before of anti-fragility. At the time, 30% of those kids who came in would come back in 2 years with a second gunshot wound. Over the course of our program, before I left in 2024, we cut that rate of 30% re-injury and 30% suicide attempts, two different things, down to 12 and 15%. And so it was not something I ever planned to do, but I got called to the work. As Dr. Donna Ho would say, you have to follow the science. I followed the social science.
So, clearly, you've been successful in just about every domain. You've excelled
Mhm.
academically. You're a master surgeon. You're a great, not only a great clinician, but a great educator, researcher, administrator, past president of the American Pediatric Surgical Association, and now the second vice president elect of the American College of Surgeons. To get there, it clearly takes a whole lot of leadership. So, tell me a little bit about your approach to leadership and what it all
Yeah,
means.
yeah. So I tell you that the way I see leadership is the way I see life. It's about building relationships that are, if you will, therapeutic and nurturing to others that allow them to flourish. I've been criticized for this analogy, but I try to lead from the middle. I am able to move to the front and lead from the front. But when I lead from the middle, I am in the core of the people who get what I want, who are self-starters. I'm next to the people who need constant encouragement, and I'm close to the naysayers or the people who are the detractors who you need to be closest to.
Well, clearly, you're an inspirational leader. How do you steer teams and institutions through adversity to not just survive through the storm, but to grow from it?
Yeah. Well, that's the anti-fragility approach. The way to steer a team or an institution is to promote humility among all of its members, particularly the leaders that you may report to. I think there's a tendency when the ship is in tough waters for the leaders to think they have all the ideas, and everyone else has to kind of get on under the board or on board with that. I think that you got to have one captain of the ship, but that captain she has to understand, or he has to understand that there are sound insights. There's someone down under that says the problem is there's a hole in the hull. We've got to fix this first. Leaders are the people that help individuals during adversity to see the light in tough times. And if there's any time that we need that now from all leaders to help us see the light and the way forward.
Phenomenal. So, as you reflect on all that you've accomplished during your career, all that you've had to overcome,
Mhm.
how would you begin to define your legacy and tell us a little bit what gives you most hope?
My greatest legacy will always be my family. Father of four, husband of one. And again, these are individuals I hope will remember my name and remember my influence. But in the world, again, this concept I give you of leading from the middle, touching all components, being boundary spanning, looking at those areas where not I have passion for, but where I have talent for to make a difference in the world.
So remarkable. And you've clearly have had an impactful life and you've transformed an entire community through your actions. So,
Well, thank you.
Ed,
Thank you.
you're one of these rare individuals that one is truly fortunate to have a chance to meet, work with, and befriend over the course of one's lifetime. I know that I
Thank
am
you.
better for having met you, for having worked with you, for being able to call you a friend and a brother. Congratulations, my friend, on being an
Thank you.
icon of American
Thank you.
surgery. It's been a
Henri,
privilege to conduct this
uh,
interview.
thank you. Henri, thank you. But remember, iron sharpens iron. And so I appreciate this opportunity.
Thank you.